marriages. People are all more concentrating towards their career. So late marriages is one of the main major cause. Healthy lifestyle or following, not following healthy lifestyle, being sedentary, main cause. Then reaching everywhere because so I don't think now with like transport and everything like improving and people getting more aware. It's not like the like remote places are not aware of this, and people who are infertile or sub-fertile always look on the internet. Internet is available everywhere. Try to live healthy, follow your cycles, know about your cycles.
Dr. Anurag, thank you for agreeing to do this interview with us. Now, before we go further, I want to introduce myself. My name is N. Jamir, and I work as a content creator and as an interviewer for SubhagTTC. And our main goal for these interviews is to democratize infertility in India. And therefore, specialists such as yourself coming and talking about what infertility is really helpful in educating the masses. Before we proceed, would you kindly introduce yourself?
I'm Dr. Anurag Mohan. I'm working as a consultant pathologist at Maurya Central Diagnostic, Pune, Bihar. I've done my MBBS from Pune and my post-graduation is from Mysore. I've worked in many hospitals such as IMS BHU. I've worked in PD Hinduja Hospital and currently I'm in Purnia. I'm giving my services over here. My areas of interest are hematology, histopathology, cytopathology, and we routinely get tests for infertility in patients. So I'm well versed with whatever infertility things we are getting. So my wife is IVF specialist, so we have been working on IVF for a long time.
Dr. Anurag, how long have you been working in the field?
I've been working for past 10 years.
So that's a lot of experience. Could you kindly elaborate to us what the role of a pathologist is in a couple's sub-fertility journey?
See, pathology is the starting point once the patient gets to a clinician. After that, pathology is the starting point because all the parameters needs to be checked. Which parameter is wrong or which is coming high or low. According to that, we can classify the patient according to what kind of infertility is there in the patient. So pathologist roles are very much essential because like in checking male infertility or female fertility, hormones, there are many fields and dimensions in which we have to check the patient. So pathology is one of the key points in IVF treatment. Like whatever necessary this thing is there, tests are to be performed by a pathologist.
So your job profile, in short, in layman's term, is to make sense of all the numbers and of all the tests and lay it out to us.
Yeah.
Thank you so much. What is the standard tests that you conduct as a pathologist for sub-fertility couples?
For fertility couples, the thing is like for male, we have to first of all see their sperm count, for testosterone levels and other hormone levels like LHFSH and all. And in females, we have to check their AMH level, LHFSH, prolactin, TSH. All these are basic tests which infertile couple go through. And after that, only people are categorized into various categories like fertility. We come to know where the problem lies, and after that, we start the treatment of that person. It can be a male, it can be a female. So whoever has a problem, then we'll have to start the treatment in their part.
Leaving the role of a pathologist aside, how would you define infertility?
See, infertility defined by a WHO standard is like a couple trying to have issue or a child for two consecutive years and not having pregnant. The wife has never been pregnant in those 2 years. We can say that they have a problem of infertility.
Would you say that the cases of infertility is growing in India?
Yeah, we are surely finding increasing case of sub-fertility in India. Even earlier, we used to say it's a problem for city people, but we are also finding that these fertility patients are coming from various rural backgrounds, and they are approaching us for infertility treatment and like for having a child, which is emotional fulfillment for their.
Dr. Anurag, as a pathologist, what would you say is the reason why subfertility seems to be on the rise?
See, fertility is on rise due to various causes. First of all, like late marriages, people are all more concentrating towards their career. So late marriages is one of the main major cause. Then the like healthy lifestyle, being sedentary is another main cause. Then various toxins which males are taking, like smoking, gutka, pan. They are also affecting their fertility. Then in females, like currently few studies have shown that microplastics are causing infertility in females. So we are even finding that their AMH levels are going down when they are in late 20s or early 20s. So that is the ovarian reserve, which is going down due to pollution there, which is going down due to unhealthy lifestyle. And there are functional causes also. It can be due to some hormone imbalance. It can be due to some physical deformity. It can be due to in both male or female. So the causes are numerous, but some causes are we have created for ourselves. So both are there, and both need to be taken into consideration for right infertility.
One thing that jumps out is microplastics impacting female subfertility. Could you care to elaborate on this, Dr. Mohan?
Microplastics are very small plastic particles which were earlier not found in human system, found in our water supply, it was found in our food supply, but it was not found. But slowly and slowly, due to I think increased amount in our food ingestion and all, I think it's going into the system and lodging in the cells which are very rapidly dividing and all, so causing problems there.
What are some standard tests that all subfertility couples should know but do not get tested on?
See, if a couple is trying to have a child for 2 consecutive years and they are not having any child, so first of all, they should visit a doctor. They
Yes.
should visit a doctor and take proper advice, like what could be wrong with them. And some tests which are doctor after consultation with both the couple, husband and wife, can take an informed decision what needs to be tested and which partner needs to be tested more. So it's a prerogative of a consultant doctor to find out who has a problem, and like he can start a treatment. But a basic test which a couple can undergo is like for male they can go for semen examination, so that they should have a good count and good motility and good sperm morphology. And for females, they should at least should go for LH, FSH, prolactin, and AMH level.
So these are some of the basic tests that people should go through for.
Yeah.
Dr. Anurag, I want to ask you about the sperm washing technique that's being used these days. Now, I understand that IVF centers are very professional and they've got big machines and they've got very high-fi products. But for small clinics, how does it impact the lack of sperm washing machine?
Uh, See, sperm washing is a technique which is used for IUI. IUI is a very simple procedure,
Yes.
and it can be done on clinic outpatient basis. So, if a consultant is starting IUI clinic at their place, so they actually IVF centers require a lot of investment, and it's like in distant places, it's not possible, or like it is not possible for everywhere to have an IVF clinic. So at least they can start with IUI. And but IUI is only like he is only successful when there is some problem with low number of sperm count in male. If the female has a problem, then IUI will not be.
Right. Unless it's like vaginismus or something where the female has a fear.
Yeah, see, IUI is only successful when you have counts are less. You will wash it, concentrate it, and put inside the female's body so that it can fertilize. Every rest of everything is done by the normal physiology of a female. So the female side should be perfect for IUI to be successful, and IUI is only successful in like 15% of the cases. So it can be done in OPD basis, and it's an initial treatment, but the female side should be checked before doing IUI.
Okay, great. Dr. Anurag, this has been some very wonderful insights. Your opinion on how subfertility treatment is reaching every nook and corner of India. For example, I am from a more remote place in India, right? Now, are those options available for other parts of interior India also, remote places?
It's reaching everywhere because even I'm also sitting in Bihar and doing IVF treatments. My wife is doing IVF treatment, and I think if it is possible in Bihar, it can be possible in anywhere in India. So I don't think now with like transport and everything like improving and people getting more aware, it's not like the like remote places are not aware of this, and people who are infertile or sub-fertile always look on the internet. Internet's available everywhere, so they try to find out what can be done. If internet's there, then they can find out where are the nearest places which they can go and get. So like I don't think so. Like very far off places, like I would say that every small village or a remotest village will be at around 200 kilometers. That will be the current situation of India. So I would say it's not that far now.
That's your great. Women trying to conceive, start going for treatment from today. What are the things that I should know but to not, or that I should keep in mind?
If you are going for a treatment, first of all, it's like you should be knowing about your cycle. You should be knowing about your cycles. You should be knowing about your hormone levels. You should be knowing about your AS levels. These are very important because even if you go for a treatment and if you don't have an ovarian reserve, then whatever treatment is there, you should get it early because if reserve is not there, then with every cycle it's going down. So it should be like. Then it's the prerogative of a consultant that what treatment he starts. But it is like it is always like case to case basis. Suppose a female which is a 20 years old and who has a very less ovarian reserve needs to get an IVF done as soon as possible, rather than a 35-year-old who has a very good ovarian reserve and they can have a natural trial or an IVF.
Great. Are there any advice that you would want to give to people trying to conceive?
Try to live healthy, follow your cycles, know about your cycles. If you are not getting pregnant, then visit a doctor, take proper advice, take proper food, and don't binge on fat and this thing, processed food. These are some basic advice I would like to say. And if you are obese, try to cut down your weight because obesity also causes infertility because they process hormones in that way that which inhibit the getting pregnant.
You mentioned that your wife is an IVF specialist. Do you advise home insemination kit to some selected patients?
Home insemination kit is nothing but I think replica of a natural process.
Right. But it can be helpful in the case of, let's say, a guy who has got premature ejaculation or some of these cases.
Yeah, yeah. Those are selective cases which where it can be.
Great. That's wonderful to know. Thank you so much for your time. May God bless you. And we at Subhag Health Tech wish you the very best in everything you do.
Thank
All right. Bye-bye.